right, so welcome everybody to today's Echo. My name is Jonathan Clemente, and I am a peer consultant and also a peer support specialist. And today I'm just going to be giving you a general overview of what the peer support specialist role looks like on a coordinated specialty care for first episode psychosis. And so I prepared a PowerPoint, and I just need to acknowledge also that there have been two other my coworkers and colleagues have assisted in the materials. Graydon Provance, certified peer recovery supporter, and Deb Rhoda, who works at the Best Center. So getting on to the didactic. So our goals for today are to just basically identify some of the ramifications of stigma, and I'm just going to give a general sketch of what that might look like for an individual diagnosed with a psychotic disorder. And then we're going to identify some of the roles that a peer support specialist would traditionally deliver services. And then finally, we'll move on to what the advantages of having an individual with lived experience looks like on an FEP team. And then we'll close with just some boundary lines of like what peer support specialist is not. And so first off, with regards to stigma, I think it's important that as a person with lived experience recovering from psychosis and an FEP team member for over 5 years, identify that society still has a long way to go with respect to its ability to understand individuals with a psychotic condition. Through the course of my own treatment, please be aware that the diagnostic terms such as schizophrenia, psychosis, and psychotic disorder carry an implicative weight. And when an individual receives these labels, there may be internal challenges not only to accepting treatment itself, but also processing these labels. Culturally, American society still seems to associate violent behavior with psychosis and serious mental illness. And even within the mental health treatment community itself, there can at times exist a certain bias against individuals who may have symptoms of psychosis, maybe seeing them as more challenging to work with, or just wanting to prefer a different population to treat, or just even maybe just preconceptions about what an individual with a psychotic condition might, how they carry themselves, or what their condition actually entails. And so as an individual who has accepted a treatment role for individuals with psychosis, you're probably already aware that many of us affected by a serious diagnosis have the same human dignity as any other member of society. We have our own dreams, life goals, and passion as anyone else. Having an episode of psychosis doesn't necessarily mean that we won't be successful in this vision of life that we imagine, but it does mean that there are certain obstacles that may require additional assistance to overcome. And so you choosing to join a treatment team and providing support to an individual who has experienced an episode of psychosis can make a profound difference. In my recovery, the help of mental health professionals has been and continues to be indispensable. Though at times throughout your professional practice, you may witness certain challenges, please also remember that in helping individuals find solutions, there will also be triumphs and insight into what helps us live out our best lives. Thank you for your openness to suspend judgment, to break the cycle of stigma, and to see our humanity, to strive to understand those of us who are so often misunderstood. So now this leads into who are peer support specialists. And so peer support specialists are basically just people that have had some measure of success in the recovery process, either bouncing back from, like I said, an episode of psychosis, or it could be other factors or other life experiences as well. And I'll get into that in a minute. And peer support workers help in the engagement process, and we can be instrumental in different roles, like, which I'm also going to get into further, but we can reduce the likelihood of relapse. And that direct lived experience just means that you're a person in recovery, or maybe you have a family member that was in recovery. And so what are the qualities that make an ideal candidate for the role of a peer support specialist. They could be just ability to empathize with another individual, an open-mindedness to multiple pathways of recovery, multicultural appreciation, an ability to relate to young people, someone that has completed the FEP program. And it could also be all kinds of stuff like just wellness tools, lived experience with anxiety, paranoia, maybe hearing voices, depression, hospitalization, different forms of therapy. All this stuff can be useful human experiences that can translate into what a solid peer support specialist would have some living experience to work with to help participants. So what is a peer support? A peer support specialist is an advocate, a bridge, a mentor, reflective listener, a human being, an outreach to the community. And so these two roles kind of go together, advocate and mentor. And advocacy can take different forms, from macro level advocacy to micro level advocacy. As a peer support specialist, I've advocated for the participants that I work for at mental health board meetings like the Adams Board. I've gone to OMAS conventions and networked with other peer support specialists, and I've advocated for first episode psychosis participants at that convention on a number of occasions with the NeoMed team. And it can also be something as simple as just sticking up for a participant, maybe in a team meeting or at just walking with them to a 12-step meeting or a NAMI support group meeting. In all those ways, you're basically advocating for them. You're kind of like bearing the brunt of the recovery load and just trying to like be a trailblazer and carve out a path for them to maybe have a better opportunity, a life that maybe they didn't imagine before you met them. And so that kind of leads into like the mentorship quality of peer support. And so when someone asks me like what I do, or I usually say that I mentor people that have been through a mental health crisis. And a lot of that is exactly, just holding someone's hand and just helping them identify, that just because you had an episode of psychosis, or maybe you have like a substance use disorder, that you can get better and that their recovery is possible. And, you can rebuild relationships, you can start a new career, you can rebuild relationships with family, and your life, like when I first had my episode of psychosis, I thought that my life was going to be over. And one of the advantages of the treatment environment that I was in was that I got to meet other people that also had similar conditions to mine, serious mental illness. And so I was able to learn from them and have like that human aspect. And then in reality, even though they weren't certified by the state of Ohio, they were providing peer support to me. They were offering their lived experience as like a buffer to the pain and frustration that I was in at that time. And so the other aspects that kind of go together is being a bridge and a resource broker. So as an individual with some success in the recovery process, you're going to have a toolkit of different information, like where to get a community meal, where there might be a drop-in center, where there's a clubhouse. Like in Cleveland, we have the Magnolia Clubhouse. We have future directions. You can call like 211 and get information about where community meals are served. Might be just also like a bridge, like linking them up with their case manager. Like you might be, as a peer support specialist, a lot of times we're kind of on the grassroots, the front lines of the operation, and we get information sometimes before the doctor or other members of the clinical staff. And so we can relay that information. Hey, so-and-so is like hungry all the time. They don't have enough food to eat. We're going to community meals. Is there any way that we could have the case manager fill out an application for food assistance? Or, hey, they're about to be evicted from their home. What can we do in terms of housing? Can we get them connected? Or, hey, they have this experience with trauma. Can we have a clinician that has like the trauma-informed care approach? So like the peer support specialist can kind of move the participant up the ladder of help and help get them help sooner than maybe would have otherwise been identified. Because having that lived experience, it's almost like the participant wants to let their guard down and they feel more trusting, like, oh, like you went through this too. So like you're not gonna judge me. So like I might like a participant might open up more quickly to a peer support specialist than say a member of the clinical staff where maybe they feel guarded, they're worried about what the diagnosis means or how they're going to be labeled or what the stigma is. And peer support specialists can also be creative problem solvers because we don't have a clinical, and this isn't to disparage the clinical approach. It's really just to say that as a peer support specialist, they might be open to alternative viewpoints of like what a psychotic condition actually really is. You know, like there have been participants that I've worked with that they don't even like believe in the term like mental illness. They feel like they have like a mental wellness. Like some people feel like that hearing voices has actually been helpful to their human experience. And so someone with lived experience might be more apt to say, oh, you know, like maybe like psychosis is actually a spiritual awakening, or they might be more apt to think like outside of the box and get outside of just diagnostic or clinical labels. Um, and this can involve, you know, like just a trust and an openness and a freedom and a certain amount of playfulness too. You know, just and just in a respectful way, like just I guess just being open to their experience and not being quick to label them with a condition. And the labels, as I kind of said in the introduction, can be difficult to process. Just from a treatment perspective and from just hearing the label itself. When I first got labeled with as having a psychotic disorder, it kind of like hit me like a ton of bricks. Like I didn't really know what to make of it. I didn't know whether the doctor was in his right mind or I was out of my mind. You know, it was very confusing. And so having someone that might be able to take a leap of faith or suspend their disbelief as far as like what those labels mean or what they imply can be helpful. And being a reflective listener is also important. And it's maybe one of the most important skills that we all have, and certainly a peer support specialist. It just being open to hearing their story. Sometimes there's individuals that they don't have a lot of positive rapport with their family or friends. They might have their community of support might be very narrow and restricted, and maybe nobody really wants to hear where they're coming from. You know, like they've been given a label and you know, maybe they're treated like they're crazy, quote unquote, or like other disparaging terms, you know. And so like a peer support specialist, having been through the ringer themselves, can be right there present in the moment and can bend an ear in a way that maybe other members of the team or maybe other members in their community or family just aren't really ready to do yet. And you know, as a peer support specialist, you could be an individual and group leader. I've facilitated like everything from art groups to going out in the community playing basketball to going on hikes in the metro parks, to going to AA meetings or NA meetings or MA meetings or NAMI meetings. We've done a lot of different stuff. Sometimes it's just meeting with someone individually, maybe for coffee or in a place where they feel comfortable. I try to meet a participant where they're at. You know, if they only want to talk about the NBA playoffs, then that might be all we talk about for a session. And I think that's okay. You know, like we're trying to build rapport and build the relationship to maybe a place where maybe, you know, they talk about the NBA playoffs for the first 3 sessions and then, you know, like for, you know, on the 4th session, they open up and say, hey, like, you know, I don't know what I'm going through. I don't know where this is leading. I need help, you know? And then they tell you their story or something. And so all that talk of just like something that they felt comfortable talking about, like allowed the opportunity for a deeper discussion about what they're going through or where they want to go with their lives. You know, and then the other thing is we're consultants to the team. And so we go back to the team and we relay the information to the team, and we can be an experiential database, a library for, you know, other team members. You know, maybe they're curious to know like what it's like to take certain medications or what it's like to actually have an episode of psychosis. And so, of course, to the level of comfort to the peer support specialist, but if they do feel comfortable sharing some of those elements with the team, hey, I had this, like I had this side effect when I took this medicine, and the participant isn't making it up. It actually, I did have my legs lock up, or I did have a really hard tremor, or I did have, whatever, there could be all kinds of different experiential experiences that can be lent to the treatment team and to benefit their knowledge base. And kind of, I already touched on this one, just like outreach to the community, being involved, like, for example, like in Cleveland, like NAMI puts on a open mic, like it's an open mic, like where participants can come and like spit poetry or speak poetry, or give like there's the OMAS also, or at the Adams Board in Cleveland also puts on like an art display where we've showcased client artwork or participant artwork at the event. And so all those opportunities bridge relationships with a larger community. And that's one of the cool things about a peer support specialist, is that they can be active in the community. They can go out to like an open mic event, or an art opening, or like a theater event, or you can be involved with the participant basically at whatever level they feel comfortable with. Taking a walk in the metro parks, going to a mall, all these sort of things can be beneficial. And then lastly, like a peer support specialist is a human being, and I put this slide in just to kind of illustrate our humanity. It's a little bit solemn, but I just wanted to I just speak to the fact that as peer support specialists, we do have that lived experience with maybe a mental health or substance use condition or disorder, and so there may be certain elements of like self-care, like additional self-care, that maybe it's important for them to have time off so they can go to their support group during this particular time of the day every week, or maybe they're only working part-time. Like, for example, I've been working part-time at Catholic Charities for the last 5 years, and that's just where I'm at right now with my workload, and that's just a part of the reality that of some of the limitations of my condition and where I'm growing. And so every peer support, as every human being, from a social worker to a psychiatrist, it's important for us all to practice some measure of self-care. And again, just, the lived experience can be anything from working with clinicians, medications and side effects, knowledge of different hospitals and treatment centers. It could also be forms of therapy or wellness tools. I took this picture, or I didn't take this picture, but I sampled this picture of people doing yoga, just because sometimes it's not like all like the psychology textbook stuff that really sustains and attracts participants to want to work with you. Sometimes it's the fact that you have the same rap album that they do, or you might have like a similar tattoo, like those sort of things, as trite as they might sound, like can be like bridges to a deeper dialogue of like what actually makes them tick and what they're actually passionate about in their life. So like being able to like draw, or like knowing something about yoga, or like breathing exercises, or the metro parks, or like having those kind of information and having those experiences to share with a participant can be vital towards like to actually getting somewhere in a treatment goal. And so, having outlined kind of what peer support specialist is, I just wanted to touch on a few things that it's not. And so I've listed some here. And peer support is not psychiatry. I don't give like recommendations to the participants about the levels of dosages a participant should be taking. I don't make any recommendations. I think you should be on this medicine or that medicine. And in fact, I don't even really usually disclose the medicines that I take, because I don't want to bias them or prejudice them into thinking that maybe the medicines I'm taking are going to work better for them. So I try to be private about that aspect of the relationship. We're also not adversaries to the treatment team. We might have a different opinion or a different viewpoint, but we're really supposed to be working synergistically with the treatment team and complementary to the treatment team. Like I said, occasionally you might have a difference of opinion about what someone is going through, and that's all part of the treatment process, but it's a team for a reason, and it's coordinated specialty care for a reason. And so, and the case manager thing and junior clinician, sometimes that can be difficult when you do work on a clinical team. There can be a tendency to want to drift into the role of a case manager or a junior clinician. And sometimes we have to fight that drift as peer support specialists to give authentic peer support. And the other drift, the alternative of the other drift is like the drift into friendship. And so even though there are aspects where you provide empathy and a listening ear and you want to be supportive, peer support isn't really, it's not friendship. Because as Pat Deegan says in one of her didactic or one of her presentations, she says that a friend doesn't document progress notes or bill Medicaid. A friend doesn't get paid for their time spent with you. And so there are some pretty distinct differences between friendship and peer support, even though there's maybe a certain friendliness that you want to exude. We're not a 12-step sponsor. We don't give directives. Peer support specialist tries to work on allowing the participants some measure of autonomy and self-determination. We're not bankers. We don't loan money out. We're also not an Uber or a taxi driver. Occasionally, like a ride can be a powerful tool to build a relationship with a participant. Maybe in the initial stages of building that rapport, you might give them a ride periodically. But we're not a transportation service. A peer support specialist ought not to be giving a ride to every medical appointment or every therapist appointment. It really ought to be encouraging that independence and the participant to help find their own method of transportation, whatever that is. And so who benefits? The treatment team benefits, and just from having that lived experience can open up doors in ways that have been truly incredible. Just so for example, just share a success story. There was one participant that had a measure of like agoraphobia, fear of being in public places, and the director at the time asked me to work with him, and we started to build up a relationship where we would just try like vacant places, and just go maybe where there'd be like a handful of people, and then slowly over time together we started to go through for like walks in the mall, and then like going into restaurants. And now the participant is taking classes at Tri-C and like doing well, and is actively engaged in like group activities like every week, and is like even like a leader in the group. And he feels like comfortable in like public places and going out to eat in restaurants. And so just like having me be able to be in the community benefited him, and it benefited our treatment team, and being able to like have someone that was able to be out in the community and bring that experience home for him. It also benefits loved ones. Seeing him make these steps has been powerful witness to his family. And then lastly, I've benefited, and there is that aspect of mutuality in the peer support specialist role, where we do benefit. I've learned a tremendous amount about what works and what doesn't work, and like how to sustain my recovery, just from listening to the other clinicians, talking with the psychiatrist, taking part in all the different informational like webinars and continuing education credits. It's been a really rich experience for me. And so thank you for your attention. And that concludes the didactic for today. And I'll stop sharing my screen here.